Okay, so today we're doing part 2 of Standard 5, How to Promote Health and Well-Being for the individuals you support and your work colleagues. It's part of the Level 2 Adult Care Apprenticeship. And in the first video, part 1, we covered the first 4 learning outcomes here, which are to know the health and safety responsibilities of yourself, the employers and the workers, to know how to keep safe in a work environment, to know what to do when there's been an accident or sudden illness, or to understand what to do with hazardous substances. If any of that's of interest to you, head over to part 1. You also want to know how to promote fire safety, know how to reduce the spread of infection, and to understand what a risk assessment is and how it can be used to promote person-centered care safely. So those last 3 are what we're going to be talking about today. Again, for this one, I explained in part 1, but you're going to still need a notepad or an open Word document, or even a speech-to-text dictation app to make some notes for this task. So, first job, know how to promote fire safety. You want to describe how to prevent fires from starting or spreading. We're going to deal with starting first, and some of the ways that you could prevent them, like not smoking, particularly in the building. If you are going to smoke or if somebody is going to smoke, then there should be a designated area made of preferably fire-resistant materials if it is a shelter, and away from the main building. This helps in one way that the main building will not catch fire, and in another way that smokers, while they're smoking, are staying away from people who don't want to breathe that in. We have no open flames, so no candles. If it is something like a birthday, then making sure candles are not left unattended. If it is something like somebody likes to have candlelight, if it's maybe a supported living setting, maybe you could suggest the little LED candles can look quite nice these days, and they have the little flickering light set up as well. So they are much safer. You get a similar effect, and it is much safer. If somebody likes maybe nice smells, they might like a room spray, or they might like one of those aerosols. I'm going to go with aerosols that release. It is aerosols that release spray maybe periodically, so they can have a nice fresh scent in the room. Not allowing rubbish to build up is important. There are 3 things that a fire needs to get going. It's oxygen, heat, and fuel. If you're not allowing rubbish to build up, then you are removing a fuel source. Having electrical equipment, boilers, etc. checked regularly. You don't want electrical equipment with faults because they can spark. You wouldn't want any wires that are frayed, that the actual wires are exposed, because potentially that could spark a fire. Boilers as well, potentially. It's rare, but potentially like there could be an explosion, especially with gas boilers. But it's just something to get checked and make sure that everything is safe. And storing chemicals as per the packaging instruction, not mixing chemicals, because some chemicals are flammable and you wouldn't want them exposed to any heat, so you definitely store them away from heat. And also you wouldn't want to mix them just in case they became very flammable or combustible together, and mixing them changed. In general, if the chemicals that you're likely to be dealing with are maybe cleaning chemicals, in general they're fairly stable, but if you mix them, you don't really know what you're going to get. And we want to describe how to prevent fires from spreading as well. So The use of fire doors is great. You want to have a good quality fire door because it can give you an extra half an hour before the fire would get through to you. If it's a good quality one, you do want to check on the quality. And you want them to be closed. So in general, most fire doors are designed to be closed. Propping them open would not be a good idea. Some places as well would have automatic doors. So once the fire alarm goes off, those fire doors, which normally stay open, are set to close themselves. So that's very helpful. Using fire extinguishers if it's safe to do so. If it's a small fire and you're confident using the fire extinguisher, then you could use it, stop the fire where it is if you can. But if you're not confident that it's safe, that you can manage it, then leave it, wait for the fire. Firefighters, it is much more important that everybody gets out. Same with fire blankets or sprinkler systems. If you're buying any clothes, if you're buying furniture or carpets or even curtains, especially curtains, make sure that it's made of a fire resistant material. It can happen, preferably if, let's say, somebody drops a cigarette on their trousers, preferably that material will not be inclined to just go and go completely up, because it can happen in minutes, especially with some older fabric types, or ideally it'll just put itself out. But it doesn't, it's the kind of fabric that doesn't really want to burn. You can see some videos on this on YouTube. I would recommend watching. There were some items on the news in recent years about children's Halloween costumes. And it was comparing different ones for fire resistance. Some, on a mannequin, mind, they lit the corner of the costume. Some of them went straight up and some of them just fizzled out. You would obviously want to check that you're getting one that should fizzle out. And that's the same with all your fixtures and fittings in a setting. And then another one I believe I've mentioned in part 1, if you've seen that, is using metal storage cabinets for papers or flammable chemicals. The paper would obviously be a fuel for a fire. Having it stored in a metal cabinet would prevent the fire from, or slow down at least the fire from getting to that fuel. And if it's slowed down, it can't add to the flames and add to the danger. It's also useful for saving your documents. I believe it's usually recommended that you keep any really important documents like passports or birth certificates in a fireproof metal box, just in case. Alright, we want to describe what to do in the event of a fire. This should really start with raising the alarm. Hopefully you'd have fire alarms that you could set off, or just warning everybody and then calling the emergency services to get the fire service out. You would want to evacuate yourselves and any other from danger. So depending on your building, just getting away. Make sure you know where your designated areas are in your building, where you're meant to gather if there's a fire. You definitely want to keep calm. Things get much more inefficient when you're not calm. I don't think I've mentioned there, I have not. Leave belongings behind. They're not important. Get yourself and everybody else out if you can. Okay, so make your way to the fire assembly point and wait for further instructions. You never go back into the building until the fire service have told you that you are safe to do so. Now, these are general instructions. You're going to want to check your own policies and procedures for any special instructions for your area, particularly if you're working with people with mobility difficulties. You're going to want to know what the instructions are for them. and to know how to help them, or if you have any other special instructions in your area. So we could pause here. I would recommend pausing here and checking your policy. Once you've checked your policy, write down a couple of notes on any special instructions, or if there aren't any special instructions, write down where your fire assembly point is. So moving on, you want to know how to reduce the spread of infection. We need to explain the roles and responsibilities of yourself and the employer for the prevention and control of infection. First of all, what can you do to prevent and control infections? Pause the video and write down at least 5 ideas in your notes. Make sure you've labeled them, that it is responsibilities, let's say my responsibilities for the prevention and control of infection. Moving on, here are some of my ideas. So you have to follow your policies and procedures for infection control, most likely, and most places in health and social care will have specific infection prevention and control policies. I would recommend reading that. You should attend training, wear and use personal protective equipment properly. There is a correct way to take on and off gloves. I would recommend looking that up if you're not one of my learners. If you are, I will show you, or I will give you a handout or the video to go with it. You want to check PPE is in good condition, so no holes, that it fits you properly, all of that. Wash your hands using the correct method. Make sure that you are washing your hands before and after using PPE. And use hand sanitizer when you can't wash your hands. So if you're out and about, away from your normal setting, there isn't a sink and soap available, definitely use hand sanitizer. Now the employer's role. The employer has to put in place the policies and procedures for infection prevention and control and monitor them. Make sure they're actually working. Change them if there is any changes in policy or best practice. They change their policies and procedures to reflect that. They have to provide training to all staff. They have to provide personal protective clothing or equipment. And part of the monitoring process is carrying out and reviewing risk assessments. It is important to include in risk assessments infection prevention and control as well. And then the responsibility of others in the workplace and individuals. When we say individuals, again, we most often mean service users. So I would say that they have a responsibility to follow instructions, to take due care of themselves and others, to wash their hands regularly. If it is others in the work setting, like other professionals or visitors, not visiting a setting if they're ill and it's avoidable. So if somebody has the flu, they're usually advised not to come to the hospital because they would spread it to people who would be vulnerable at that point. Again, using hand gels if they don't have soap and water available, and sneezing into tissues and disposing them in the bin. So not just sneezing everywhere, sneezing into a tissue or sneezing into your elbow if there's no other option, and cleaning up as soon as possible. Okay, the next one, we want to describe the causes and spread of infection. So infections are caused by bacteria, viruses, fungi, and parasites. We have a couple of examples here. So for bacteria, most people will have heard of E. coli and Salmonella. They're the main ones that cause food poisoning. Viruses like the flu include various strains, or measles is caused by the rubella virus. I find it quite interesting anyway that viruses are not technically alive. whereas bacteria, funguses, and parasites would be alive. Okay, so fungal diseases include ringworm, which is highly contagious, and aspergillosis, which I have difficulty saying. But that one is caused by mold. If common household mold. And some parasites include worms like roundworm, hookworm, tapeworm. There are some um, flies like bot flies that can bury into the skin. Not common in the UK, thankfully, but there are possibilities. Worms are, unfortunately, a bit common in the UK. So, things to keep an eye on. And further to that, other causes and the actual spread of infection could be not washing hands before and after cooking or after using the toilet, coughing and sneezing without covering your mouth and nose, so that things like flu virus can live very well in those little moisture particles that come out when you've coughed or sneezed, and they can be transferred to others that way. Let's see, coughing or sneezing into your hand and then touching other surfaces. Those viruses and bacteria, they can live on those surfaces for a while, and if somebody else comes along and touches that surface, they might then touch their face, and that's a good way to transfer an infection. I put down overflowing bins, standing water, because they can attract, let's say overflowing bins outside, they can attract rats, which might attract, they might have fleas covering them. The fleas might transfer to the person, and that could transfer diseases that way. That was how the Black Plague was thought to have spread, through fleas. Standing water is another one. Some insects breed in standing water, in still water just outside. So, and they can be insects of the biting variety. So that can be a way that diseases get passed around and infections spread. You also have poor food hygiene. Again, referring to Salmonella or E. coli. If food isn't prepared and washed and stored properly, very possible to pass on and spread infections that way. Okay, we want to describe ways to reduce the spread of infections. So this can be following policies and procedures that actually are designed to prevent and control infections. We should all be following these policies and procedures. Participating in training, any relevant training, including COSHRID or food safety training. Mainly it's infection prevention and control training. There is specific training for that. And then these ones are related as well. There are a few more. But these are the main ones to my mind that you'd want to know about. I did put down RIDOR there because of its reporting of injuries, diseases, and dangerous occurrences regulations. So if there was an outbreak of something fairly contagious like measles, then that's the sort of thing that gets reported and tracked. We have ensuring you use PPE correctly, definitely. Make sure you're following your training for that. Ensure you know and follow the correct hand washing technique. I've included a video here, the NHS video on how to wash your hands properly. Pause this video and go and watch that one. Alright. We want to outline ways to ensure that your own health and hygiene does not pose a risk to others. So again, washing hands regularly and correctly is a big one. Using hand sanitizers when you can't wash your hands regularly and correctly. Hand sanitizers aren't as good as soap and water, but they'll kill most bacteria. They're also not as good in that they will dry out your hands. So if it's all you're using, you're going to get very dry hands, It might come about that you've got little cuts on your hands that maybe you can't even see from the skin drying out, and you're just more likely to get an infection that way. Not coming to work if you have been vomiting or have diarrhea or flu symptoms. If you've had vomiting or diarrhea or any contagious symptoms like that, you do want to stay home for about 2 days, just to be safe. Let's see, not wearing any jewelry, because settings or grooves on jewelry, it can be a good place for bacteria to live. It's very hard to clean out any grooves properly. Keeping hair tied back. If you wear a tie as well, you would want to wear a tie clip. Like doctors used to wear bow ties in hospitals because the tie is loose fabric or loose hair can brush against things and pick up bacteria. So keep hair tied back. Keeping your nails clean and short would be a good one, because now it is very hard in these days with the popularity of fake nails, but for 2 reasons you want to keep your nails clean and short. 3, off the top of my head. I could keep going and add more, but we're going to say for 3. 1 is for the appearance. People don't want to see dirty nails because it will make them nervous. I wouldn't want anyone doing personal care for me if they've got dirty nails. It doesn't build confidence. For another, longer nails, it is much easier to gather dirt and bacteria and other bits and pieces under longer nails. If you keep them short, there is less space for the bacteria to live in. And for the last one, if somebody has maybe long nails, they could be sharper, more likely to scratch somebody, more likely to pop a glove, as in to go through the glove. And it's just more likely to spread infection that way. If you're scratching somebody, you create an open wound. Aside from the discomfort that would be caused to somebody, you've created an open wound where bacteria or viruses or whatever could get in. Alright, wearing clean clothes is definitely one. As I was saying before about the ties, loose fabric or any fabric can pick up bacteria very easily. It's brushing against things. And you just want to make sure that your clothes are clean. Storing and preparing food correctly. We have mentioned E. coli and Salmonella before. We definitely want to make sure we're following the proper guidelines on storing and preparing food. And in general, you want to maintain good personal hygiene, so as an overall note. Next up, we have to understand what a risk assessment is and how it can be used to promote person-centered care safely. If we don't remember, or you've never heard the term before, person-centered care is when the care and support that's being provided is very individual to that person that you're supporting. It won't be the same as everyone else is getting because that person's needs and wishes and preferences and history is going to be different from everybody else. So, how can we use risk assessments for that? First of all, we want to know the difference between a hazard and a risk. So a hazard is something with the potential to cause injury or harm, like loose wires, loose carpet, maybe sharp edges on furniture. Potentially, those could cause injury or harm. The risk is the probability or likelihood that harm will occur. If that sharp corner on a piece of furniture is in a well-trafficked area, maybe it's a narrow area that people are always walking past, then it is highly likely that at some point somebody's going to get caught in that. If it was something sharp, let's say a knife, and it's kept in a drawer, less likely to cause harm while it's in the drawer. When it comes out, it's got a different risk level. So it is about the likelihood. We want to explain the purpose of risk assessments in adult care. Now, when we say explain, it usually is best to make sure you include an example or two to illustrate your point and make sure you've fully explained it. So let's have a look. Explain the purpose of a risk assessment in adult care. We use the risk assessment to identify hazards and to try and find ways to reduce the risk associated with that hazard. So it could be used to assess fall risks, infection risks, risk associated with display screen equipment or hazardous substances. And it could also be used to promote person-centered thinking and least restrictive approaches. So let's think of an example for this. Let's say we work in a care home for older people with dementia. Now, quite often, older people with dementia, they get a little bit more unsteady on their feet as things progress. So they would have an increased fall risk. A way of managing this might be to put down sensor mats in their rooms. So when they're getting up, the sensor mat would trigger an alarm in the office and we would know to go and check on them and make sure they're okay. When we have, let's say, using display screen equipment, that might be for staff who often work in the office, often doing, let's say, data entry or writing reports or filling out daily living records, that we have covered the risks associated with that, because there are quite a few. Let's say if you have a chair with legs, a chair with 4 legs, you can't move it around, you can't adjust the height, you can't adjust the back, you have more of a risk of developing, let's say, poor posture, muscle injuries as you go along, especially if you're sitting there often. If you're looking at the screen, the light can cause headaches, so that is something to consider. And you might mitigate these risks by replacing your 4-legged chair with a good desk chair, the kind that's on wheels. You can move in and out easily, you can adjust the height up and down, and you can move the back in and out to get more or less support as needed. I'd also say not to get one with arms on it, or at least to get very small arms, so that people can move as close as they want to the actual desk. So that's one. For display screen equipment, actually looking at the screen, making sure we know how to adjust the brightness, making sure people have adequate breaks from using it. And then we want to make sure we're talking about how to promote person-centered thinking and least restrictive practices or approaches. For this, let's go back to the falls risk. Some people might think to mitigate that falls risk by putting up barriers on the side of the bed so people can't get up easily without help and they've got to call. But that might be very restrictive compared to putting down a sensor mat so the person can come up, can get up if they want. It is up to them in the end. And just have a member of staff come and check and make sure they're okay. So we are thinking about what individuals want themselves. Person-centered thinking is all about asking that individual, what do they want, what do they feel safest with, how do they want to live their lives. And a lot of people will not be happy to have those, forget the proper name for them, but the barriers that you can raise on the side of the bed to stop people falling out. You'll see them on hospital beds. In their daily life, they're not going to be okay with that if there's any other option. So, let's talk about the process for carrying out risk assessments. The first thing you do is identify the hazard or hazards, decide who could be at risk from harm and how. The risk could be different depending on different people, like the risk of a young person in the work setting might have to be considered in a different way to an adult in the work setting. If somebody has a pre-existing injury or condition, then their risk might be different and might have to be considered differently as well. So often we might do individual risk assessments, but if it's in general for groups of people, we might consider who might be at a particular risk. You want to evaluate the risk, so say whether it's a high, medium, or low risk. Low risks, high and medium risks you have to address. You want your risk to be low. The probability of something going wrong and somebody getting hurt, you want that risk to be low. It's very difficult to absolutely eliminate risks. There will always be some risk. Even walking down the road, we're at risk. So we have to manage it and try and keep it low and do what we can to stay out of the medium and high risk areas. So on that, decide how to reduce them, how to reduce these risks. You want to record your finding, record your next steps, record any changes to policies or any particular guidance for this maybe task, for this person, whatever it is. And then you would want to put down a date to review the risk assessment. It might be that you'd review it in a month, in 3 months, next year, but you would want to make sure you monitor it and change it if necessary. Which brings us to a job for you. I want you to look around the room you're in now. Following the procedure we talked about in the last slide, carry out a risk assessment. Record your findings in your notes, maybe under a table like this, and then you can show it to me or your tutor just to see what you've actually done and talk it through. If you'd like, you could go on to the HSE risk assessment pages and have a look at some examples there. I would recommend it. So, yeah, pause the video now and go ahead and carry out your risk assessment. You can choose more than one. Definitely, if there's more than one risk that you can identify, choose more than one. Okay, pause your video. Moving on. Right, explain how risk assessments can be used to promote person-centered care safely. We've talked a little bit already about person-centered care, person-centered thinking, and least restrictive practices. So how does that work with a risk assessment? For it to be person-centered, you would talk to that person individually, evaluate their needs, risks, and abilities and weaknesses as an individual. In care homes, for example, falls risks tend to be done individually. Each person, each resident in a care home has a risk assessment. If it was, you couldn't have the same procedures in place for everybody because maybe one person needs more support, one person needs less support. If you were providing the exact same support or risk management to everybody, then either someone is going to end up being unnecessarily restricted or someone's risk is not going to be managed properly, and procedures that could have been put in place for them won't be put in place. Either way, if someone needs less support and you're putting more restrictions on them, then that could head over into the institutional abuse area. It wouldn't be deliberate, you would be trying to protect somebody, but by doing so, it could possibly be institutional abuse. We want to avoid that. We also want to avoid the case where somebody needs more support and they're not being provided with that support or risk management, because it increases their risks and then we wouldn't want them to get hurt. So one of the ways you could do that is completing the risk assessment with the individual. You might sit down, I would even recommend sitting down by yourself or with your colleague beforehand and thinking about that individual's risks and what you'd want to say to them. But when you go in, making sure you're prepared with different options that they could take and what you are recommending. But you would want to take into account their feelings and their views on the subject, and as much as possible go with their feelings and views on the subject. These can be used to raise awareness with the individual of health and safety risks. For instance, if somebody is inclined to smoke in bed, doing a health and safety risk assessment could be a good opportunity to raise the issues with the person. And it could be used to address dilemmas between the individual's rights and health and safety concerns. For example, that person who wants to smoke in bed. It is their right to make choices, even if they are not what the choices that we would make ourselves. Even if we think they're a bit odd, people have a right to make their own choices. So, that's the person's right. Our dilemma is that smoking in bed is very risky. It really does increase the chances that person could have an accident and could end up seriously hurt or could lead to death. So we definitely have a dilemma there between that person's rights and choices and our health and safety concerns. You could help to address those health and safety concerns by carrying out a risk assessment. And on that risk assessment, you would offer the person maybe fireproof bedding as much as possible. It's not perfect, but it would be better, or a fireproof apron that could keep if they drop the cigarette on their clothes, maybe while they're sitting on the sofa, that their clothes would not catch fire then. It's not perfect, but it would address the choices and make things a little bit safer for them. And then in the risk assessment, you would include always using the fireproof bedding as a measure that you're putting in place to manage their risk. Okay, so that brings us to the end of Standard 5, How to Promote Health and Safety. Please complete your workbooks if you're one of my learners and show me your notes from this session. Thank you very much. I hope you enjoyed.